In this video at Medical Sciences, we are always privileged and glad to make our channel as your study center. And in today's video, we want to talk about drug interactions, where we are going to look at drug-to-drug interaction, we're going to look at food-drug interaction, and disease-drug interaction. So, we are saying when these drug combinations occur, we're going to see how do they interact together when they are combined to produce either, we're going to see when drug interacts with a drug, or when food interacts with a drug, or when disease interacts with a drug, what do they result into? And we're going to see there are three end results of this reaction, whereby it can either increase the effect of the drug, it can either decrease the effect of the drug, or it can cause adverse effect when they are combined. So these are the three end results of drug interactions. So we're going to begin with part A, which is going to be drug-to-drug interaction, whereby we are seeing combination of different drugs, what do they result into? And drug-to-drug interaction, we're going to see four effects that are brought about, which is cumulative effect, additive, synergistic effect, and antagonistic effect. So we're going to discuss one by one as we're giving examples. And under cumulative, the word cumulative means here that when a single drug, when a drug is given repeatedly, here when you're giving a drug repeatedly, or maybe you are giving two drugs in a combination, but these drugs, they produce the same effect. So whenever you continue to give them repeatedly or in a combination, we are going to see the reaction increasing. And we normally present it under graphically, that if we have a drug on x-axis and the response on the y-axis, at the first exposure we see this drug is not stimulating, maybe this is drug A, but after repeated exposure, we see it increasing in the response. And this is what we call cumulative. Then the next effect produced when drugs are combined together is what we are calling additive effect, or you can call it summation. Here we are going to see the effect of the drug when the effect of combined drug is the same. Here the key word is that it is the same. It is the same as the sum when these two drugs are given separately. The sum when these two drugs are given separately. So the effect of the combined drug is the same when you add the effect when these drugs are given separately. For example, when we have drug A and we have, which is having 30 response, and drug B is also having 30 response, we find when we combine them, A plus B drug, it produces 60. So the effect produced when they are combined is the same as the sum when given separately. That is what we are talking about. Under graphical presentation is that if we have a graph of the drug versus response, we are going to see if we give drug A and we give drug B separately, their sum is the same as the effect when given in a combination A plus B. So this is what we are calling additive. We're going to see that the effect when we add them up is the same as when given in combination. So this is additive effect. And example of drugs under this, examples of drugs that produce additive effect, we have codeine when combined with the paracetamol. Sometimes we have, when we combine aspirin together with the caffeine, we produce also an additive effect. And another thing is when we combine tramadol, when tramadol is combined with the paracetamol still, we produce high analgesic effect. So these two examples, codeine plus paracetamol together with the tramadol and the paracetamol, we see them producing additive effect. Then another effect under drug-to-drug interaction is a synergistic effect. This synergistic effect, this is whereby the effect of the combined drug, here the effect when given in combination is higher. Here the effect is higher than the sum, of drugs given separately. When given separately. So here the combination effect of the drug A and B when combined produces a higher response than the sum when given separately. That when we give separately a drug A with the response of 20 and the drug B has also a response of 20, but when given in combination, it produces a response of like 70. And we see this response is greater than the sum when these two drugs are given separately. And under the curve, we can always illustrate it, whereby if we have a response on the y-axis, and we have response on the dose, on the drug dose, on the x, you see if this drug is A, and we give another drug B separately, the effect produced when they are combined is far away much than the sum. If the sum was stopping here of the two drugs, we are seeing the effect when given in combination is higher than the sum. And here examples, we normally give examples like amoxiclav, whereby this amoxiclav is the combination of amoxicillin combined with the clavulanic acid, whereby clavulanic acid is a beta-lactamase inhibitor. So when it inhibits beta-lactamase, then amoxicillin is not, the beta-lactam ring of amoxicillin is not destroyed, hence producing a synergistic response. Another thing is whereby we can see combination of ceftriaxone together with sulbactam, also sulbactam being a beta-lactamase inhibitor. So that is also synergistic effect. Then lastly, under drug-to-drug interaction, we are going to look at antagonistic effect of drugs. And under antagonistic effect, we are going to say that when you give an agonist, that is a drug, in combination with an antagonist, this antagonist is going to exert, or it is not going to allow the agonist to express or to produce a response on the receptor. Hence, when given in combination, the response is less. Here, the response is less compared to the sum when given separate. So here we are producing reduced response in the presence of an antagonist. And this antagonist, it can either be competitive antagonist, it can be non-competitive, it can either be physiologic and chemical antagonist. So I want to begin with competitive. This one is an example of competitive antagonist, that in the presence of a competitive antagonist, the agonist, both agonist and antagonist, they have the same configuration. And because they have the same configuration or shape, here they compete for the same. They compete for the same binding site at the receptor. And because they are competing, we can always overcome this antagonistic effect by increasing the concentration of the agonist. When we increase the concentration of the agonist, then we overcome the antagonist, because this agonist outcompetes the agonist. And here the end result is that it results into a decreased potency. The potency of the drug is decreased, which is seen by the curve shifting to the right. For example, if this is the curve when it is only agonist, this is for agonist only, we are going to see when we combine the two, when we combine both the agonist, here this is for the antagonist alone, then when we combine the agonist together with antagonist, we see the curve shifting to the right. Shifts to the right, meaning we are decreasing potency, because the more the EC50 of the drug, if this is the 50%, the more the EC50 increases, the less potent the drug becomes. And this is in a combination of both agonist plus antagonist. So the end result is produced is decreasing the potency of the drug by shifting the curve to the right. When the curve shifts to the left, the potency increases. When it shifts to the right, when it is to the left, it decreases, then to the right, the potency is decreasing. So here we are saying the effect of competitive antagonist decreases the potency of the drug by shifting the curve to the right. The curve shifts to the right in the presence of an antagonist. Then for the part B is the non-competitive. For non-competitive antagonist, here they have different, the antagonist and the agonist have different configuration, or you can call it shape. For example, if I consider the lock and the key of the enzymes, but this is now the receptor. If this is the receptor and this is the agonist, then I have the antagonist with a different configuration. So the antagonist and the agonist have different shape. So the antagonist, because it has different shape, cannot bind to the binding site, but rather it binds to the allosteric site of the receptor. And after binding to the allosteric site of the receptor, it causes a configuration change and it changes the binding site of the agonist. So the agonist can no longer recognize the binding site, and this one becomes irreversible because we destroy the active site, so that the natural agonist can no longer bind to the active site. So because we are saying they have different configuration, here the antagonist binds to the allosteric site. Allosteric comes from the word allos, which means different site. So this one is the allosteric site other than the binding site. And this one cannot be overcome by increasing the concentration, because we have already lost the shape of the active site after binding at the allosteric site. Therefore, this one we cannot achieve maximum response even when we increase. So if we have this graph of response versus dose, and this is the antagonist, because antagonists, for them, they don't produce any pharmacological response. For them, they bind, but they do not produce response. But if we give an agonist alone, this is only at the agonist. It produces maximum response, 100%. But when given in combination with a non-competitive antagonist, the curve does not shift to the right, but it decreases from maximum. This is in presence of both agonist plus antagonist. So the response decreases, and that's why we end up by saying that this antagonist, which is non-competitive, for it decreases drug efficacy. This one decreases drug efficacy. This one decreases potency, whereas this one decreases efficacy. So whenever you're asked in an exam, you should be able to distinguish what is the effect of the competitive and the non-competitive. The competitive one decreases potency by shifting the curve to the right, whereas the non-competitive decreases efficacy by downward or decrease in the response of the drug. That is what we can discuss under competitive and non-competitive. Then we have covered the competitive and non-competitive. Then the next one we can talk about is physiologic antagonist. And under physiologic antagonist, we're going to see for them this is according to their mechanism of action, whereby two drugs, when combined, they produce opposite reactions or opposite response. That is under physiologic. So under physiological antagonist, we are going to see that when these drugs are given in a combination or at the same time, they bind to the receptor and produce opposite response from the agonist. For example, if I'm giving a drug such as insulin, and this insulin is going to decrease sugar levels at the liver cell. But in case I combine it with glucagon, when the glucose is gone, this glucagon at the same time it is going to increase blood sugar levels. So this one is producing an opposite reaction. And this peculiar example is also seen under histamine and adrenaline, whereby histamine, when it binds to the bronchus of the lungs, it causes bronchoconstriction. So when you combine it with adrenaline, and adrenaline produces an opposite reaction, which is bronchodilatation. So that is what we are calling physiologic antagonist. This was number 2. Then number 3, we can talk about chemical antagonists. And under chemical antagonists, these ones, they are known as antidotes. They are known as antidotes. They are chemical agents which bind to the receptor. And these chemical agents, when they bind to the receptor, they inhibit the action of the agonist, or they remove the agonist, preventing their reaction. So they are used as antidotes, especially in drug toxicity. For example, when someone is maybe intoxicated with paracetamol, they are given an antidote known as NAC, which we now call N-acetylcysteine. N-acetylcysteine, which relieves this toxicity of paracetamol by inhibiting NAPK. Another example of a chemical antagonist is like in cholinergic agonist toxicity, or maybe you can say heparin. In heparin toxicity, we normally give an antidote such as protamine. Then when you are intoxicated with methanol, maybe you're working in the lab and you're intoxicated with methanol, we can always give you fomepizole as an antidote. Then with the cholinergic agonists like physostigmine and neostigmine, we can always give you atropine as an antidote. So there are many antidotes used. Chelating agents like metals, when you are intoxicated with heavy metals like lead, like iron, we can always give you an antidote known as suxima. And this suxima, which is bar, is also an antidote which can reverse the toxicity of that drug. So these are the three categories of antagonists we can discuss: competitive versus non-competitive, physiologic and chemical antagonists. So finally, this one marks the end of 4 reactions of drug-drug interaction, which we have said we have cumulative effect, additive effect, we have synergistic effect, and antagonistic effect. After looking at that, we are going to part B, which we are going to look at drug-food interaction. Here we can talk about briefly about drug-food interaction. How do drugs, when they are taken together with the food, how does they? Some act, as we said in the beginning, by increasing absorption or decreasing or chelating. So, as we go to drug-to-food interaction, we are going to see drugs like benzodiazepine. If you have a drug like benzodiazepine and you combine it with grape juice, this grape juice is known to induces. This one does not actually induce, it inhibits cytochrome P450 isoenzymes. So when it inhibits these isoenzymes, which are responsible for metabolism of benzodiazepine, meaning benzodiazepine is going to increase in blood concentration, bringing about a toxic effect. And another combination is when you combine digoxin with oatmeal. This oatmeal will decrease its absorption. Then another combination is when you are on paracetamol and at the same time you are taking alcohol. This combination leads to liver toxicity, what you call liver damage, or what you can call drug-induced hepatitis, and so on. And we normally see even when you combine drugs like cephalosporins, such as ceftriaxone, and you take it together with milk, we see milk decreasing its absorption. But when you take milk with anti-malarial drug like coartem, we see milk increasing the absorption of coartem, but it decreases absorption of cephalosporins. That is what we call drug-food interaction. Then lastly, we can discuss also what we call drug disease interaction. And under drug disease interaction, we're going to see when some drugs are given in certain disease conditions, they cause or they worsen or they decrease the effect or they worsen the disease. For example, when someone is diabetic and at the same time hypertensive, and you give metformin, this metformin in hypertensive patients, it results into what we call lactic acidosis, which can lead to coma and death. So it should not be given in people with diabetes at the same time as hypertension. Or you find someone has asthma, and this asthmatic patient, you give them drugs like NSAIDs. These NSAIDs, they act by blocking the airway, or they cause bronchoconstriction, hence worsening the condition. Or someone has heart failure, and you give them drugs like beta blockers. When you give them beta blockers or you give them nicotine, maybe someone has hypertension and you combine it with nicotine, it can bring about decreased heart failure. And this one can increase heart rate, which can worsen the condition with people with heart failure, with majorly hypertensive, when they are hypertensive, and you combine them with nicotine. So this is some of the drug-disease interactions which are contraindicated when someone has a disease condition. So this is what we have discussed about, that is drug-drug interaction, drug-food interaction, and drug-disease interaction. Hope you have gained a lot at Medical Sciences by Naftali Muhumza, and we are always privileged to make us your learning center at the comfort of your places. Thank you so much, and may the good Lord continue blessing you.